Patients who are sedated or under general anesthesia are extremely vulnerable and defenseless. They are unable to witness intimate procedures that are being performed and are powerless to ensure their wishes and values are being honored. Therefore, they are unable to exercise their rights to refuse intimate exams, procedures, and tasks. Harmed patients who were subjected to non-consensual pelvic exams, and medical students who observed and performed them, demonstrated bravery in speaking out against these unethical practices. And they ultimately played a vital role in getting laws in numerous states passed, thus protecting patients from non-consensual pelvic exams. Here is an example you can find in the New York Times. Ashley Whites underwent an unnecessary pelvic exam in the emergency room at a Utah hospital. She had gone there for uncontrollable vomiting and declined a pelvic exam, but the doctor sedated her and performed one on her anyway. Here is an example of a courageous medical student, Ari Silver-Eisenstad, who, in 1993, refused to perform pelvic exams on patients. A surgeon argued that the patient knew students would be involved and became angry with him after he refused to perform a pelvic exam on an anesthetized patient. However, Ari stated that even if the procedure were performed on alert and awake women, the act would be unethical because the patients would be under pressure to consent. "I thought that was coercive," Silver-Eisenstad said. "I'm walking in and saying, 'May I do this to you?' She's got to refuse me face to face and fear that her refusal might have implications for her health care." After his refusal to comply with orders, Ari met with the medical school's OB/GYN course director to let him know that he wouldn't participate in delivering babies because, quote, "those women were not asked about a medical student participating in the delivery of a baby or watching." Ari's brave actions helped bring to light these unethical practices. It is very disturbing that there is a heavy emphasis on medical students performing pelvic exams. It is absurd that medical schools require their students who are going into specialties such as orthopedics, cardiology, and otolaryngology to learn how to perform intimate procedures. Medical schools need to change their curriculum and reduce unnecessary intimate procedures. The truth is, too many unnecessary pelvic exams are performed on healthy women in the United States. The most reliable way to diagnose ovarian cancer is through ultrasounds and blood tests, not pelvic exams. Read our article, Truth About Pelvic Exams, at www.patientmodesty.org/pelvicexams.aspx for more information. Now we are going to address other intimate procedures. Go to www.patientmodesty.org/nonconsensualexams.aspx to check out our article, Non-Consensual Pelvic and Genital Exams and Intimate Procedures. While it is encouraging that an increasing number of states have statutes banning non-consensual pelvic exams, thus criminalizing this practice as a form of sexual assault, these laws fail to address other intimately invasive procedures performed without a patient's knowledge or consent, which should never be done. These laws need to be modified to require expressed consent for all intimate procedures, including breast, genital, and prostate exams, in addition to other intimate tasks such as inserting urinary catheters, shaving and cleansing the groin and pubic area, placing grounding pads on the buttocks, and removing the gown and underwear resulting in exposure of private areas. It is important to address these issues because women are not the only ones who experience harm from intimate boundary violations in medical settings, as demonstrated from these articles, not just non-consensual pelvic exams in Voices in Bioethics and the Legal and Ethical Imperative of Explicit Consent in Intimate Medical Procedures in American Institute of Healthcare Compliance. They can be found under the Resources section in our article, Non-Consensual Pelvic and Genital Exams and Intimate Procedures. Medical patient modesty has received many troubling cases from patients who never consented to intimate procedures and tasks. Many of them have post-traumatic stress disorder. Sadly, it leads some to avoid medical care, including potentially life-saving screenings and procedures in the future. Here are some cases we have received that highlight why the pelvic exam law should be modified to include other intimate procedures or tasks. 1. A patient had his gown and underwear removed after he was put under anesthesia for surgery on his hand. 2. A patient who underwent neck surgery was horrified to discover that a urinary catheter was inserted. 3. A patient was horrified to learn that hospital staff had removed the disposable underwear they had given him and shaved his groin and lower abdomen while he was sedated for a venous ablation procedure that involved the surgeon making incisions around the knee only. Check out his blog at www.medicalmetoo.wordpress.com. At many other facilities, the groin and pubic areas for this type of procedure are not shaved. He was also livid to learn afterwards that his procedure is more commonly performed in an office setting with a local anesthetic instead of in an operating room with sedation. But he was never presented with this option. Medical professionals subjected each of these patients to unwanted intimate tasks and procedures without their prior knowledge or express consent. Medical professionals are rarely, if ever, held accountable for performing unnecessary intimate procedures or without explicit consent. For example, a female otolaryngologist, Dr. Twana Sparks, who performed genital exams and drew images on the bodies of anesthetized patients without their knowledge or consent, was allowed to retain her medical license and continue practicing by the New Mexico Medical Board in 2009. This doctor's license should have at least been suspended for sexual abuse. There is no reason for otolaryngologists to ever access intimate body parts since their job is focused on the ear, nose, and throat only. This example highlights why so many medical professionals continue to perform intimate procedures and tasks without consent. Until we see punishment in the form of steep fines, prison time, and the suspension of medical licenses, medical professionals will continue to subject their patients to intimate procedures and tasks without their knowledge or consent. Medical patient modesty would appreciate your financial support to help combat these issues and keep patients safe. You can donate by going to this webpage at www.patientmodesty.org/donate.aspx.